I'm Alyson Shogan, and I'm an internal medicine resident at Duke. I actually worked in banking directly after college, but found myself spending most of my time volunteering in the healthcare setting. In particular, I grew up with my grandparents living with my family, so I was volunteering a lot in nursing homes and loved working with an elderly population. So I made the decision to go back to medical school, and still loved working with that elderly population, but liked the mix of patients that you got in internal medicine. Working with elderly patients, they have multiple medical problems, and so they're a more complex patient population to manage a lot of the time, and the focus is not always on fixing one particular thing or going in and doing one particular surgery, but you really have to understand the whole picture, and it's about balancing a lot of different issues that are going on with those patients. And I like it because they've had such a wealth of life experience that they can share with you, but you also get not only the patient involved, but the whole family involved in taking care of the patient. The first time I meet a patient, I like to obviously go over their medical history and their different medications, but also spend a fair amount of time at that visit getting to know who they are as a person. My favorite part of my job would be talking with patients during the day, dealing with patients. I really enjoy getting to know them, and I think that in order to make the biggest impact, you really have to understand where the patient's coming from. I try to listen to what patients say and work with them to achieve their goals and figure out what's important to them and what they want to focus on with their health. To me, what really sets Duke apart is the people, and everyone at Duke really wants to put patients first, from the physicians to the nurses to environmental services to everyone in administration. I think we all work together as a team, and everyone wants to go above and beyond to put the patient at the center of the experience.